right, we're now with the Metro Health Department, and Dr. Paul, if you would introduce your colleagues, yourself, and then make a statement about how your year's been, and then talk a little bit about the budget.
Thank you, Mayor Dean. Good morning, Mayor Dean, Mr. Riebling, Mr. Heinout. I'm Dr. Bill Paul. I am the Chief Medical Director of the Metro Public Health Department. With me are Stan Romine, who heads our Bureau of Administration and Finance, and Diane Pardon, our Director of Finance. Also in the audience today is our Board President, Mr. Bill Hance, back from some time off for medical issues.
He looks fantastic.
For the
record, reflect.
We're really happy.
The way he looked before. So
we're very happy to see him. I want to start by thanking you for your support of public health. Your message has been very clear. The health of the people of Nashville is vital to the health of our city. Healthy children learn better. Healthy workforce can attract employers. And a city that weaves livability and opportunities for healthy living into its fabric can attract and keep people of all ages to live and to thrive here. We've had some great opportunities with grants over the last few years, but Metro's support of the Public Health Department has been shrinking. We took significant local cuts the last few years, and the bottom line today is that we are still running very lean, but our 2% budget reduction scenario is overshadowed by bigger state cuts, and we do need to restore some local support in key areas. And so our budget request this morning is for a net increase of $256,000. I'm going to get to the specifics of that request in a minute, but I do want to talk about how we've been doing this year, and it's been an exciting year for us. The Communities Putting Prevention to Work grant added momentum to Nashville's movement towards healthier eating and active living. This is a 2-year cooperative agreement with the Centers for Disease Control, supported over 20 projects all over Nashville with a unifying brand of Nash Vitality, and it really reflects our community's efforts across Nashville to become more healthy, active, and green. Here's just a few examples of the accomplishments. We expanded your Green Bike Initiative with help from Metro Parks and Regions Bank, free bikes for people to use on the greenways. We helped 5 corner stores in food desert neighborhoods to carry healthy options and promote them. We supported dramatic growth in community and school gardens. We helped Metro schools add momentum to their efforts to offer healthy food for students. We worked with Nashville Humane and others to extend spay and neuter services in neighborhoods with high numbers of animal complaints. We've actually spayed and neutered over 1,000 dogs in high-risk areas, and we think this type of activity has a lasting ripple effect in the community. We worked across Nashville to make breastfeeding more the norm. That's in our birth hospitals and in businesses and in workplaces as well. We helped support the Walk 100 Miles and the Mayor's 5K challenges, and we were really happy to be a part of that. As of now, the major grant period for CPPW is over, but we did receive a no-cost extension which lets us finish a few key projects. 2 examples are a kiosk-type bicycle share program and some wayfinding signage that helps highlight opportunities to walk and bike. We're working with Metro Public Works on that. These projects and more are already making healthy choices easier choices for people everywhere in Nashville. Beyond CPPW, we continue to provide a wide array of services that protect and improve health and well-being for people throughout Nashville. We opened a new WIC center on Nolensville Pike to help better serve our growing numbers of customers. We kicked off the New Life Project, which is a comprehensive effort to improve the life of high-risk children by providing skills, education, and resources to men, the fathers, to effectively parent their children. You know, public health, we have lots of efforts to support moms and kids and infants, and this is important that we have an opportunity to better support dads in their efforts to connect with the lives of their children. We continue to work in children's preventive oral health, and actually the numbers of children with untreated oral disease has been going down year after year. Food Protection Program continues to work to make sure every food establishment is doing what they need to prevent foodborne illness. There's more. We do a lot for Nashville. We recently provided you with a comprehensive update on the activities of the department. A few comments about our budget and our budget request. The Public Health Department is funded mainly by local, state, and federal sources. Right now, about half of our operating budget is paid for with local tax dollars. But as important as the health of our city is, the local investment in public health has been shrinking. In fiscal 2006, we had 313 staff members on local funds. This fiscal year, it supports 208. That's a 36% drop in locally funded staff in 6 years. We did take significant reductions in local funding the last 3 years, 9% in FY10, 5% in FY11, and 3% in FY12. Now, the local cuts were softened by the CPPW grant, which helped us avoid layoffs. We were able to move some of our core prevention and wellness team, as well as 2 animal control positions, onto CPPW for the duration of the grant. CPPW funding is ending as expected, and so there is a sizable cut that we already anticipated and planned for. But we also do need to have a source of funds for these few positions that were temporarily funded by the stimulus. At the same time, we're facing cuts in the state and federal level. This year, we're facing significant cuts from the state. Ends of the several grants, the Child Abuse Prevention Grant, Project Diabetes Grant, and Advertising Grant for Tobacco Control. We anticipate the end of the Police and Fire Wellness Program, which has been funded by the Benefit Board. So on top of the end of the CPPW grant and the 2% reduction scenario, we're facing over $1.4 million in cuts from the state. So the request before you includes a 2% reduction in the local budget, as well as some improvements or restoration of funds. And so the net is a request for an increase. Proposed reductions are a proportional percent decrease to the grant, or the contract with United Neighborhood Health Services for homeless health care. Elimination of 1 vacant engineering position. This is for septic systems, and nobody's really people are building fewer septic systems now. And then in the public health clinics, a reduction of $271,000. As you know, we received an increase in family planning funds from the state, and our expectations is that these funds will expand service and we'll be able to see clients that are not able to continue at Planned Parenthood. We're tracking our numbers and those of Planned Parenthood carefully, and we think it may be possible to both provide expansion in service and reduce Metro's subsidy of that program. So that's part of our reduction is really the reduction of the local subsidy to the family planning program. And those are the reductions. Beyond the 2% scenario, we are requesting some restoration of funds. As I said earlier, 4 key FTEs in prevention and wellness, and this is important for us to sustain at least some of the effort that's been started with CPPW and position us to continue to be a leader in prevention and wellness as a health department and as a city. Restoration of 1 animal control officer. We had been running at 29 officers for many years. In '07, the council added 2 positions, and we were at 31. With the economic crisis, we lost 3 positions. We were able to support 2 back on the CPPW grant. CPPW is ending, and the bottom line is if we are able to add 1 officer, we're brought back up to 29, which had been the baseline. We're requesting a position to continue our efforts on radon. The Metro Council passed an ordinance in 1989 that required us to test Metro buildings for radon. I can't really explain why this wasn't done for so many years. We have stretched our staff to do it, but we do believe it's important that we sustain this effort.
Where are you on that in terms of?
We've made it through all of the Metro buildings and all the schools, and we're in the process of working with schools to identify plans for reducing numbers that are elevated in a number of the school buildings. So there's a lot of this relates not to specific activities about radon, but activities about how does heating, ventilation, and air conditioning work, and how well is it maintained in the schools. And so we're working with them on an action plan for getting the numbers where they need to be for the Metro schools. Most of the schools are fine. There are a number that still need some work. There's an infectious disease physician on the request list. With recent cuts, we overshot. We lost too much physician capacity. We were trying to do one physician do infectious disease, including TB, as well as the civil service medical examiner. And we haven't been able to cover both with one position. So we're requesting an additional physician. Finally, on capital budget, we're really thrilled to be getting closer to groundbreaking on the new public health headquarters on Charlotte. We do need to have on our agenda in the coming years a new facility at an acceptable location in the southeastern part of Davidson County. This would be a long-term replacement for the Woodbine facility. And at this time, we have a long-term need, but no specific plans. So on balance, we're reducing a little bit, but we are requesting some restoration of local support in some areas that we believe are essential for Nashville. And the net increase, by my calculations, is about $256,000, and it really does reflect a continued lean approach to our management of the health department. I'm sure you haven't heard this before, but I also kind of want to put in a plug for the staff of the health department, who along with other Metro workers have been really working hard and working with fewer colleagues without a pay increase. And so I'm sure we'd all be interested, if the funds were available, to make that available for our staff. So once again, I want to thank you for your commitment to health in Nashville.
Thanks. Well, first of all, we did spend a lot of time together this year working on the Nash Vitality, and that will continue going forward. And you know, we make a plug for we have on May 5th is the field day at LP Field, where all Nashvillians are invited. It's for the young from starting at 5 to 105 to come out and participate in field events on the field where the Titans play, and there'll be Titans there to learn about different exercise techniques and to actually have some fun games too. And then the water park will be open that day too. So for kids, it'll be a real treat to be able to be on the playing field with the Titans, and then also to go over to the water park. And hopefully that'll be another step toward making the city more healthy. I believe it's important that I mean, clearly we don't change people's health by having walks or by having a race, but it does elevate the public awareness of the issues we face as a community. Tennessee still ranks in the bottom 5 for adult obesity and childhood obesity, and it's a serious issue, and I thank you for your leadership and all that. Is there any opportunities, as the state's new anti-obesity campaign, is there enough information about that to know whether there's any additional funding potentially from the state to help us on that issue?
I mentioned in my remarks about the Project Diabetes, which is basically an anti-obesity. It's the STEP show, the Step Up to Health program, and you actually were honored by your presence at kind of the tournament they had at Belmont University. We've been very proud of that. There may be continuation of funding that can continue that particular program, but in terms of an expansion of funding, I haven't heard of anything that's a big opportunity. We had been hoping that with the Prevention and Public Health Fund and healthcare reform, there'd be more opportunities, and there may still be some opportunities, but that's also been kind of a contentious issue in Washington about funding health departments to do this kind of work. So we're always wanting to position ourselves to go after grant funds. I haven't heard anything specifically about the state. The state, I think, part of the conversation is really getting companies and getting businesses involved in community-wide efforts to improve health and well-being.
Okay. In terms of the new building, what is the forecast for groundbreaking on that?
I believe we're on track to break ground in August. We've been doing I mean, the architect firm and HCA have been doing great work with our staff to identify our needs and fit everything in and work things out on the site. As I understand it right now, we should be poised to break ground in August, and then it'll be about 18 months to build.
Okay. And you mentioned the need for a facility in the southeastern part of Davidson County. Is that a complete regional health center, or is it?
Yeah, I mean, I think the Woodbine Health Center is in an old school building, and maintenance needs, it needs work. It's kind of an old building that's not going to be lasting forever. So thinking in the long run where the population is that we serve, and the kind of services we provide, that is what we have in mind, is kind of a public health facility that's fairly broad in its scope.
Okay.
To replace the Woodbine one.
And then this year, how did we do with the flu? Was it?
There's a little bit of flu still out there. It's not too late to get your flu shot. But it's been a incredibly non-event as far as flu this year.
Is there any other epidemic or that anybody's been talking about that we need to?
There's always something on the horizon. I mean, there's people are watching flu in various capacities. What kind of strain is going to come through. But this year, I guess we got a pass.
That's good. That's good. Okay, and then for animal control, overall, how's that going?
I think we've done some very good work in really trying to focus on the right things and improve our management efficiency, accountability. We've got computers on the trucks. We're using GPS and using a kind of a computerized system as far as dispatching our officers. But it's hard work, and the staff has been pretty thin. So I mean, I think overall the numbers seem to be going in the right direction, with fewer running at large complaints, fewer requests for service. But I know that we've got a ways to go in terms of both, the overall problem of animals running at large, and our ability to respond in a timely fashion to every call that we get.
Okay. Rich?
I have one question. Dr. Paul, on the positions that move to CPPW that you're proposing bringing back to the health department, what are they specifically? I want to make sure I understand that. What do they do?
Diane, do you have the list with you? I mean, one was basically the director of our division of health promotion.
Okay.
Some of these are actually partial FTEs. One is partial epidemiologist.
Or if you just want to get that to me later, that's fine.
Yeah,
too.
I can get that to you. So it's kind of the core staff of what was our health promotion division, and I can get you the specifics of what the positions were.
Okay. That's it.
Great. Well, thanks for a great year. I had the opportunity last week to see, I guess, a preview of the Nashville portion of the HBO film.
Oh, really?
Yeah, so that's, I guess, a couple months away, or a little bit less than that for the premiere. But Nashville looked good, and some real good footage of the Hadley Park walk, and it's a very good series. I watched one full episode, and it makes a pretty strong case for what you've been talking about now for quite a while.
That's great. We really have appreciated your leadership and your support for all these efforts towards healthy living, and appreciate your continued activity with the Mayor's Field Day. If you don't mind, I'll plug that and plug the Workplace Challenge as well. The Mayor's Field Day, people can go to www.mayorsfieldday.com and find out more about it and actually register. And the other is your Mayor's Workplace Challenge, which you rolled out last week.
Right, and we're looking at encouraging employers, because people spend a good portion of their day at work, to look at 3 areas where they can encourage their companies and their employees to improve on, which include the environment, being a greener city, but also health. And we went to it's a Barge Wagner, probably the largest engineering firm in the city, actually is doing boot camp twice a week at Riverfront Park. And then the third area that we're encouraging people to look at is volunteerism. And the idea is that people can monitor how they're doing, report, and then the city will acknowledge those companies who are making strides to improve in those areas. And if we get, I think we will be able to get a large number of companies involved, I think that will have a real positive effect on the quality of life in Nashville.
Yeah, I'm very excited about it. And I mean, it's amazing to see. I mean, it's kind of an opportunity to highlight the leadership that's already going on out there in different companies. There's great ideas, great creativity as people address these 3 things.
Right.
And there's a good website, too. That's www.mayorsworkplacechallenge.org.
Very good.
So people can get resources, find out how to really kind of work in the workplace to make it more healthy, environmentally friendly.
Yeah. You're for that, right, Rich?
Yes, sir.
All right, thank you.
All right, thanks.